Well, since the COVID-19 pandemic began, we've heard a lot about the nurses on the front lines in hospitals, but we haven't heard much from them until tonight.
That's right, Tom. I talked with a nursing leader and one of the nurses on her team from Parkview Health in the Fort. Each day since the pandemic set in, they've been caring for COVID patients, and they want us to know a few things about the battle against the virus in the Fort. One, it's serious. Two, we can all do our part to help bring it under control. And three, they wouldn't be anywhere else than the front lines. Since the COVID-19 pandemic began, national newscasts have sometimes taken us inside big city hospitals in hotspots. We've seen the crowded floors, patient beds in the halls, the sickest of the sick fighting for their lives.
You'll see the patients on their belly. They can no longer, a lot of these patients can no longer oxygenate on their back. Their lungs are so stiff because of the virus.
In the Fort, Parkview nursing leader Heather Hans says it's the same.
We're manually, turning these patients on their bellies with all of their tubes and lines.
To keep everyone safe, photographer Daniel Beals and I met with Hans and nurse Amy Payne at the Miro Center Simulation Lab on the Parkview Regional Medical Center campus, where constant training takes place. I wanted to hear what it's like for patients and for them.
It's a lot different than it was 20 years ago. It's a lot different than what it was 8 months ago.
Hans has been a nurse 24 years, with Parkview the entire time, Ivy Tech and University of St. Francis educated, married, and the mother of 3.
I've always worked part-time since I've had the kids, but with COVID, we've been working more than full-time.
She's now in charge of a team of nurses, men and women in the medical ICU who've cared for COVID patients each and every day the past 9 months and learned a lot.
We know what we're doing. We know how to care for these patients. There was no manual that this virus is coming out and this is what we're going to do. And we've been able to do it and I think provide the best care possible.
Nurse Amy Payne wanted a career in agriculture until she was diagnosed with a serious illness.
I kind of made a deal with God and with myself that if I survived and was able to, I would go back to school and be a nurse. I had a lot of great doctors, but it was the nurses that really made a difference.
She's been a nurse 12 years, nearly 8 of them with Parkview. Ivy Tech and Purdue educated, married, the mother of 6. At work, these nurses do all they can to stay safe by wearing lots of protective equipment. And when they get home, they do all they can to keep their loved ones safe.
Everything comes off in the garage. The car gets wiped down with Clorox wipes, and everything goes directly into a sanitation mode in the wash, and I get straight in the shower.
But even when they're home, a part of them remains at work.
My mind is at the hospital with the patients. I know how sick they are. The patients that are in the ICU because of COVID are very ill.
We almost feel safer at work because we're surrounded by people that understand what we're going through. And when you're at home, it's just not possible for our husbands, our children, our parents to understand what it is we deal with.
COVID patients can spend more than a month in the ICU, and unlike before the pandemic, families have not been allowed inside ICU patient rooms. They're either nearby or connected through technology.
We aren't leaving your loved one in there to suffer alone. We are in there, we are touching them, and we are comforting them. And families know that, and they see that through the iPad, through the Zoom.
It's heartbreaking. It's heartbreaking to watch a family member with a mask, gown, gloves, everything, sitting in the hallway looking through that glass door while we're in the room with the patient as they're taking their last breath. When you have to facilitate a Zoom call with a family telling their loved one goodbye and they can't be there, and you're holding the patient's hand and you have spent time with them, a lot of times you just wonder, God, where are you in this?
They both say they lean on their faith and on lots of support from their families to make it through these difficult days.
We've met before work in the chapel. We've prayed. We have a holistic response team that will come and give us some TLC.
We've all prayed with patients over the years and prayed with families, and I think we do that even more now because they are alone.
These nurses are strong, but they're also human, and they, just like us, dream about the day COVID is under control. They say it will happen sooner if people in the public, who are often so thankful for healthcare workers, come together.
It's not just the flu. We don't politicize the flu, and we shouldn't be politicizing COVID. We have to practice social distancing. We have to wear masks. We have to do anything we can do to help mitigate the spread, or it's not going to go away anytime soon.
I wish that everybody could take a peek into our ICU and see what we are dealing with on a daily basis.
Heather and Amy, thank you. Both nurses say they understand that people in the fort are going through COVID fatigue, but they say with these alarming numbers right now, we simply cannot let down our guard.